How often do you think about your prostate? Probably never, until something starts feeling off. The truth is, most men don't pay attention to their prostate health until symptoms become impossible to ignore. And by then, the problem might have already progressed. Many men assume that urinary difficulties, discomfort, or changes in sexual function are just part of aging. But what if these symptoms are actually your body's way of warning you about a deeper issue? After the age of 50, the risk of prostate enlargement, prostatitis, and even prostate cancer increases significantly. In the US alone, prostate cancer is diagnosed in nearly 1 in 8 men during their lifetime, according to the American Cancer Society. The good news is that early detection can make all the difference. The bad news? Too many men ignore the early warning signs until it's too late. Today, I'm going to reveal 4 symptoms you should never ignore. They might seem minor at first, but they could be critical indicators of prostate disease. Pay close attention, because recognizing these signs early could save your health and even your life. One of the most common yet overlooked early warning signs of prostate problems is difficulty urinating. If you've noticed that you're struggling to start urination, experiencing a weak or interrupted stream, or feeling like your bladder isn't emptying completely, your prostate may already be enlarged. As men age, the prostate naturally grows. This condition, known as benign prostatic hyperplasia, BPH, affects nearly 50% of men over 60 and up to 80% of men over 80, according to the American Urological Association. Here's what's happening inside your body. The prostate surrounds the urethra, the tube that carries urine from the bladder. As the prostate enlarges, it presses on the urethra, creating a bottleneck that slows or even blocks the flow of urine. This results in a weaker stream, difficulty starting urination, or a constant feeling of needing to go. If ignored, BPH can lead to serious complications such as urinary tract infections, kidney damage, or even complete urinary retention, which requires emergency treatment. Many men assume that struggling to urinate is just a part of getting older, but it doesn't have to be. And if you're waking up multiple times during the night to go to the bathroom, the issue could be even worse than you think. Have you noticed that you're waking up multiple times during the night to urinate? If so, you might be experiencing nocturia, one of the clearest signs of prostate enlargement. At first, it may seem like a minor inconvenience. You wake up, go to the bathroom, and go back to bed. But over time, frequent nighttime urination can become a major problem, leading to chronic sleep disruption, fatigue, irritability, and even a weakened immune system. A Harvard University study found that men with an enlarged prostate wake up to urinate between 2 and 4 times per night. That's not just annoying. It's a sign that your prostate is putting pressure on your bladder, making it feel fuller than it really is. If you're getting up several times a night, don't just assume it's normal. It could be a warning sign that your prostate is getting too large and affecting your bladder's ability to function properly. And if, in addition to this, you start experiencing pain while urinating, things might be even more serious. Experiencing pain, burning, or discomfort while urinating isn't something you should ignore. These symptoms are often linked to prostatitis, which is an inflammation of the prostate gland. Prostatitis can be bacterial or non-bacterial, and it can cause a range of symptoms, including sharp or chronic pain in the lower pelvic region, a feeling of constant pressure or discomfort in the lower abdomen, difficulty urinating accompanied by intense burning or pain. According to the National Institute of Diabetes, and Digestive and Kidney Diseases, prostatitis affects around 10 to 15% of men at some point in their lives. If the pain is accompanied by fever, chills, or body aches, it could mean you have a bacterial infection that requires immediate antibiotic treatment. Left untreated, bacterial prostatitis can become chronic, leading to long-term discomfort and urinary dysfunction. While pain during urination is a red flag, there's another symptom that's even more serious, and it's one that men too often ignore until it's too late. Symptom number 4, blood in urine or semen. If you ever see blood in your urine or semen, do not ignore it. This is one of the most alarming warning signs and could indicate a serious underlying condition, including prostate cancer. According to the American Cancer Society, Prostate cancer is the second most commonly diagnosed cancer in men, and in its early stages, it often doesn't cause any noticeable symptoms. Blood in the urine or semen can be caused by increased pressure in the prostate's blood vessels, inflammation or infection, abnormal cell growth in the prostate, which could be cancerous. If this symptom is also accompanied by persistent pelvic pain, sudden weight loss, or difficulty urinating, seek medical attention immediately. Early detection of prostate cancer dramatically improves survival rates, so never dismiss this warning sign. Now that you know the 4 symptoms that could signal prostate trouble, what can you do to protect yourself? While prostate problems become more common with age, there are steps you can take to lower your risk and keep your prostate healthy. Eat a prostate-friendly diet. Focus on leafy greens, tomatoes, nuts, and fatty fish, rich in omega-3s. Limit alcohol and processed foods. Excessive alcohol and unhealthy fats can trigger inflammation. Stay active. Exercise regularly, particularly activities that promote circulation in the pelvic area. Stay hydrated. Drink plenty of water to flush out toxins and maintain a healthy urinary system. Get screened. After age 50, regular prostate checkups can help detect issues early. Taking care of your prostate isn't just about avoiding discomfort, it's about ensuring long-term health, energy, and quality of life. Many men neglect their prostate health until problems become too severe to ignore. But paying attention to early warning signs can prevent complications and improve your long-term well-being. If you've been experiencing difficulty urinating, frequent nighttime urination, pain while urinating, or blood in your urine or semen, don't wait. Consult a doctor for a professional evaluation. Now I want to hear from you. Have you ever noticed any of these symptoms? When was the last time you had a prostate checkup? Drop a comment below and share your experience.